Emma's laughing at the ducks in a row. Molly's chasing chickens through the muddy grove. Lucy's got flour on her freckled nose. We're a long way from where that old highway goes. Horseradish and honey on a chip plate, spicy sweet just like the life we...
May 16th, 2020. So I'm still in Boston at this point. I'm just getting ready to leave. My contract is closing up. The COVID unit there has been closed down and everybody is back into the regular ICU. So the wave is starting to flatten as far as COVID patients go. Remdesivir was the first antiviral that kind of came out that we were testing. COVID swab tests were now being administered to people. They only had like a 50% accuracy rate, but still there was something out there. And then we just started to venture into the convalescent plasma. This brings us to July 2020. So the first round of COVID was still going on. Like I said, the states had released the stay-at-home orders, and so the curve that had been flattening was completely out of control at this point. I took another COVID crisis travel contract here in California at a local county hospital that was like a level 2 trauma working on their level 1. So we'll say they were practicing as a level 1. So this was a county hospital practicing as a level 1 local in the East Bay of California. In my orientation class, there were 30 of us nurses. They brought 30 nurses into this hospital to try and help with the overflow of the ICU COVID patients that they had. This journal page brings us to February 1st, 2021. I had been working COVID for over a year. The same stuff, the same virus, the same disease, killing so many people for over a year. I was working 60 plus hour weeks. I was doing a Monday through Friday, 7 a.m. to 7 p.m. with lots of overtime in between. I was dying, guys, when I say that I was so exhausted. I have never been so stressed, fatigued, and irritable in my life. The mental health of the staff was absolutely terrible. My coworkers were tired, exhausted, and frustrated and leaving the bedside in droves. With this variant, we were seeing a lot of younger people getting sick and dying from this. So people from 28 to like 40 were getting sick and were not able to overcome the COVID virus, which was really alarming for a lot of people, of course. This is also when the vaccine was open to public for the very first time, and when the monoclonal antibodies were available to give to people with compromised immune systems. I was one of 2 nurses at San Joaquin General that was able to administer this, and we had to go into a completely separate building and unit that was like COVID safe to administer this. It was a pretty big deal. This next journal entry was something that I was kind of dreading doing on video because these are all true stories that are something that I remember vividly that happened during that time of COVID. Of course, we had emergency orders for everything. Hospital was completely impacted. Everybody did the best that they could at the time. There just wasn't enough. There wasn't enough of a lot of things, and so patients were compromised. So next I'm going to go into some of the things that I remember. These are patients that will live with me forever, and I did have nightmares and in regards to like recreating these scenes and incidences over and over again. So I'm going to go through them, and just know that some of this is kind of graphic and you may want to skip forward if you are sensitive to this kind of information. Long-term paralysis without sedation or bispectral index monitoring. Versed, fentanyl, and Ativan drips maxed out for weeks and weeks and then turned off. Cold turkey, no withdrawal care. This next one's a doozy. A pregnant COVID patient leaves against medical advice on high flow maxed oxygen. She comes back, has an emergency C-section. Mom ends up coding on a rotoprone bed, and the baby ends up dying from a cerebral hemorrhage. Tracheostomy dislodgement, hemorrhage from the site. MD response super slow despite overhead paging and multiple calls. Emergency surgery unsuccessful, and the patient passes away. Man vs. drill. A man drills a hole in his head with an electric drill. He ends up having some minimal residual, no psych consult, and sent home. We had nurse travelers training new grads that got hired on. We had travelers training travelers. They had a nurse strike during this time where I charged over a unit, which is insane because I had been there less than a year. And then doctors were not receptive to any kind of nurse ideas or concerns or questioning of their orders. This brings us to July 29th, 2021. We're about a year and a half into COVID, and we are seeing pretty much the same thing this entire time. So as the world thinks that COVID is getting better, they're questioning the vaccine, they're questioning all these treatments, thinking that it's fake. There's still lots of people who are really, really sick and dying. So this was a hardship for nurses because we first came out as like the heroes of healthcare, right when COVID first came. And then a year and a half later, there was certain instances where nurses were being assaulted at grocery stores and in parking lots because of the healthcare system and the failure that it had to patients. So the hero thing kind of fell flat, and nurses were actually being threatened by this time. So I added this part of the journal in here because I wanted to show just how ridiculous these COVID crisis travel pay contracts are. And this one, I believe it's an $8,000 a week. Of course, this is going to be for 60-hour weeks, right? But it's insanity. And if you think about it, it's really just supply and demand. And that's just how stretched thin they were on finding nurses. They were offering these outrageous numbers, but the environment of which you would go to work was so unsafe that even that amount of money was not worth it. So by October 26th, 2021, I was finally moving on from that county hospital with all of my PTSD traumas and going to a smaller ICU in Merced, California. This is where I met some of the best nurse friends that I was going to make. And this hospital, even though it was full of really, really sick patients and COVID patients too, the staff itself was pretty amazing. Here's a photo of the rotaprone beds that I've mentioned a couple different times. Essentially, a patient would be completely sedated and paralyzed. They would have no recollection or memory that they were in this, ideally. And this bed would rotate the patient, spreading the alveolar fluid that would build up in their lungs from COVID and ARDS and help distribute it. Ideally, you would see them improve with their oxygenation and perfusion. January 26, 2022. So I started my first COVID crisis contract in March of 2020. So we're going on almost 2 years of this. We're holding strong. COVID is still going. And nurses at bedside have been doing the same thing for almost 2 years now. Public is out doing, like, making their life back to normal. And still at the bedside, we're seeing sick people still. So I just want to emphasize how intense this COVID was, and as the world starts to go back to normal, the bedside and the hospitals are still in this like hamster wheel of sick patients. May 29th, 2022. So I am exiting the travel nurse contracts and trying to take a permanent position at a bedside in a smaller ICU. I'm getting remarried at this point. How I found time to date is beyond me, and a little foreshadowing, it didn't go that great. So I'm exiting the travel nursing contract. I'm trying to slow down my life, trying to calm my nervous system, and I end up, you got to stay tuned for the next episode, because I end up doing some flight nursing in there. I end up taking another position at a different level 1. I end up leaving nursing altogether for a hot minute. And my want for a slower, more peaceful life really starts to develop during this time. So this is where like the homesteading, the interdependence on community and less dependence on government starts to kind of form. So here we go.
Emma's laughing at the ducks in a row. Molly's chasing chickens through the muddy grove. Lucy's got flowers